Ladies and gentlemen, we'll reconvene with the consent calendar. We've been requested to move C5, C6, and C7 for discussion. Ms. Lucero, if you'll come forward and pose your questions. So we'll start with C5. C5 is a conflict of interest code for the Anderson Union High School District and Anderson New Technology High School. Please.
I'd like to know for C5, C6, C7, for each one of them, can you explain to me and to everybody else, I guess, can you break it down exactly why? I've been seeing a lot of conflict of interest lately that you've been approving resolutions and amending. Can you give me a breakdown why you're doing each one?
All right, the question then is directed to Mr. Cruz through the chairman. Mr. Cruz? Mr. Lees? Are they the same question for all three?
It's just that my concern has always been the conflict of interest. It does apply to certain public officials, so I know that the conflict of interest could be where people could be charged with criminal charges if they're, there's a conflict of interest. That's why.
Ms. Lucero, does the same question apply to all three, C5, C6, C7?
Well, you don't give the whole breakdown of exactly why you're doing it and everything, and all of a sudden, like I said, I've been seeing a lot of conflict of interest that you've been approving.
I understand that. Does your question apply to the three agenda items?
Yes.
Thank you.
You're welcome.
Mr. Cruz?
In response to the inquiry, I'll give a very brief explanation for the board and for the public's understanding. Under the Political Reform Act, or I should say certain local agencies as defined in the Act are required to adopt a conflict of interest code. This includes school districts, which are the ones before the board, and charter schools, which is also the ones that are before the board, and also the Shasta Community Services District is also a local agency. In adopting a conflict of interest code, and the law says that they have to meet certain requirements. One is they have to they could adopt by reference the provisions in a particular regulation established by the Fair Political Practices Commission, which these have done. They also have to identify designated positions to whom the provisions apply to, and also have to identify the categories of particular financial interests that they need to disclose. And those are also identified. In that regard, this board's responsibility under the law is as a code reviewing body. And what that means is that for these types of local agencies, it's the board's responsibility to approve their conflict of interest codes. Essentially, have they complied with the essential elements of the law? In my opinion, these codes do meet the elements as established by the law and the Fair Political Practices Commission, and that is why they're here before the board today. There may be others in the future that will be coming to the board because as there are many local agencies that each one has to adopt a conflict of interest code, then they will then be coming to the board for adoption and approval. And of course, I'm happy to answer any of the questions if there's any confusion about that process.
Mr. Chairman, I'd like to move approval of C5, 6, and 7, please.
Supervisor Modi?
Yeah, I'll second that. And I just wanted one clarification. How often do these agencies review their conflict of interests?
I believe generally they can review them every year if they so choose, if they need to change them. I think they are required by law to review them every 2 years.
And that would explain maybe why we see them come to us.
Correct.
Every time. About this time of the year, we see a whole bunch of them come forward. It's not just unique to these particular entities.
I would not say so, no.
So we see them all the time.
So, ladies and gentlemen, we have a motion and a second to approve C5, which is Anderson Union High School District and Anderson New Technology. C6 is conflict of interest for University Prep School, and C7 is conflict of interest code for the Shasta Community Services District. Is there further discussion of the motion? All those in favor of the motion, please say aye.
Aye.
Opposed? Motion carries unanimously. Thank you. We will now go to regular calendar. Continued general government, R6. Administrative Office Board of Supervisors. 1, receive a legislative update and consider action on specific legislation related to Shasta County's legislative platform. 2, consider approving and authorizing the chairman to sign a letter to the California Environmental Protection Agency, which expresses concern with the Cal EPA and California Office of Environmental Health Hazard Assessments draft California Communities Environmental Health Screening Tool. 3, consider approving and authorizing the chairman to sign a letter to Caltrans requesting relocation of the Fall River Mills community sign on State Route 299. And finally, to receive supervisors' reports on county-wide issues. Mr. Lees, on number 1.
Thank you, Chairman Keough and members of the board. We're asking for a couple considerations of letters to be sent forward. First of all, let's take the Fall River sign one. This is an opportunity for us to acknowledge the community request to have the sign located at a position that's appropriate for the community. And this is something that has been put together. Caltrans is just asking for us to go ahead and agree or at least confirm our support of that community out there in doing this. And I don't know if Supervisor Giacomini have anything to add, but this is in response to their request.
Yes, exactly. I think Caltrans' concern was that last time it got moved, it kind of maybe wasn't as formal a process. So we did meet out on the ground, select a good location with Pat Minturn came up. Several citizens were there, as well as a worker with Caltrans. And I think we found a good sign. They just want to formalize the process a little more.
So I would be looking for support from the Board of Supervisors if they prefer to.
Supervisor Giacomini, would you like to make a motion, please?
I would move we send this letter to Caltrans moving the Fall River sign.
Second.
Okay, have a motion and a second. Those in favor of the motion, please say aye.
Aye.
Opposed? Motion carries unanimously.
The second comment letter that we're asking you to consider is attached with your packet, and it's to send a concern to Secretary Matthew Rodriguez, the Secretary of Environmental Protection, as far as their new screening process. Now, this comes to us actually via Supervisor Baugh, but it was discussed in the RCRC meeting on Wednesday, I believe, and they had taken a vote, and the majority had asked for counties to weigh in on this because it is actually an item that could not only cost money but can slow any growth down, and we want to be concerned about that. And so because of RCR's position and we supporting that RCRC, I'm asking the board to consider sending this letter, and I'll ask Supervisor Baugh if he has any additional comments.
No, you've covered it quite well. The concern is that in attempting to identify large swaths of California, the state of California, they might inadvertently apply this as a tool of literally no development zones within the state of California. And there had been very few counties that had weighed in. All of our organizations that we supported this, CSAC as well, and asked us if we would weigh in individually with the 32 counties prior to it going for a final vote.
So I'd be looking for a recommendation for the board.
Would you like to make a motion?
I would move.
Is there a second to the motion?
I'll second.
Thank you very much. Further discussion of the motion? All those in favor of the motion, please say aye.
Aye.
Opposed? Motion carries unanimously. And now we come to supervisors' reports on countywide issues. We'll start with Supervisor Giacomini.
Thank you, Chairman Kehoe. Had a busy week this week. I met with the executive officer and a couple of staff people with the Sierra Nevada Conservancy. Had an excellent meeting Thursday with the Fall River Valley Chamber of Commerce. Had some very good discussion there, with business owners coming forward with things that they would like to see at the county, and we'll have ongoing discussions and regular reports. I was able to, and it was such an honor to be able to present plaques on behalf of the entire Board of Supervisors to 2 new Eagle Scouts from Bernie, Colton Ferguson and Joey Tariba. It was a fabulous ceremony, really wonderful day, and 2 very deserving new Eagle Scouts. And then yesterday, I was able to go to the Fall River Hospital. And I mentioned, I think last week, they've got the capital campaign ongoing to build a new hospital and to retrofit the current hospital. The employees of the hospital have far surpassed the goal that they had set in their contributions to this hospital building fund, $283,000 almost $1,000 an employee. So yesterday we had an ice cream social at the Fall River Hospital, and this afternoon we'll have one at Bernie celebrating their employee contributions. So it was awesome. So that's my report.
Thank you very much, Supervisor Giacomini. Supervisor Modi.
Yes, I attended the NACWA monthly meeting, and the paperwork and reports are upstairs, so if anyone wants to review those. Also, via conference call, participated in the Northern Sac Valley Integrated Regional Water Management Governance Committee as we move forward to make a recommendation to the full board on our governance structure moving forward after probably September.
Thank you, Supervisor Modi. Three things I'd like to mention. I went on a tour of the Empire Recovery Center over on California Street. It was about 3 hours. I had a wonderful time, and I really got a good grounding on the positive work that those folks do over there. And if you get an opportunity, you may want to go to that center. Dr. David Dennis took me on a tour, and it was very productive. As we mentioned earlier, I was principal of the day, and Ms. Pregmore made a presentation. And finally, last Friday, I attended the Health Collaborative meeting, and there's lots going on there, and I'll make an in-depth report later on. That concludes my observations. Supervisor Baugh?
Thank you, Chair Kehoe. Several things. The RCRC meeting, as noted earlier, I have provided a kind of a recap of meeting highlights for each of the member of the board and staff, and there's extra copies over there available for the public as well. I'm going to refer just to one of the items listed on here, and it's the state responsibility area fees or taxes, whichever way you'd like to refer to it. There was a general consensus that there are a number of bills that we acknowledge that are kind of presented in the legislature, but they literally do not, there's no feeling that they have any legs. They're not, they do not have bipartisan support, and mostly presented individually by a single legislator with little hope that they're going to go anywhere or be taken seriously. Now, another item that is getting a lot of conversation at the state, though, is what is referred to as a repeal and replace. There's a growing momentum among both sides of the legislature, Republicans and Democrats, to consider repealing the SRA fees, and in its place would be a tax that would be on every property owner in the state of California, a much reduced tax that would be used for hazards and within the state. So that could have kind of a more of a collective appeal, not just firefighting, but with any disaster services within the state of California. Now, whether that goes anywhere, it really requires that a group of bipartisan legislators put their name on it and bring it forward. Otherwise, that's just so much conversation as well. I wanted to also mention that I attended on behalf of the board, and Mr. Lees, thank you for attending with me, the Golden Umbrella Retired Senior Volunteer Program. Ladies and gentlemen, I have to tell you that the audience was full of, my guess, 200 to 250 of the most incredible volunteers that this county has, representing dozens of agencies throughout Shasta County, and collectively tens of thousands of hours on an annual basis volunteered. Now, the part that I always find significant is in order to receive a recognition, and we presented dozens of them on Friday night, you have to be at least 60 years old before your hours count. It doesn't mean you can't volunteer when you're younger, but the hours don't count until you turn 60. I just wanted to say thank you to the many volunteers. We would not survive in this county without them, and they are everywhere in every agency that you can imagine. So God bless you all. I also wanted to say congratulations to the Anderson Chamber. Their award ceremony was on Saturday night, and again, 200, 250 people in the audience presenting and receiving awards for leadership, entrepreneurship, and as service providers. I wanted to mention the several names that received awards. The Distinguished Service Award went to Patrick Wallner, Wallner Plumbing, Heating, and Air. The Grace Bell Memorial Award went to our own Christine Haggard, and as you recall, Christine received our Employee of the Year honor, and here she is receiving one of the highest honors in the city of Anderson at their annual dinner. Public Service Award was given to Anderson Police Officer Robert Modine, and what an incredible man he is. We appreciate his service. Business of the Year honors went to Gone for Free Recycling, and the Customer Service Award, there was a tie. It was shared by Copycats Printing, that's Shauna Austin, and Trevor Duggan, who has owned and operated for the last several years Dube's Deli in Anderson. So my congratulations to all. I would like to also make note that the Cottonwood Town Hall is this Wednesday at the Cottonwood Community Center. There is a fundraiser at 5:30. Come and spend $8 on a meal. It will go to help the community center's operations. They do not receive any public funds. And at 6 o'clock, the presentation begins. First, from members of nonprofits and service agencies in the Cottonwood area, and then to follow a presentation by Sheriff Tom Bosakin and myself in regards to AB 109, and it should be an interesting evening. So I invite everyone to attend. Thank you.
Thank you, Supervisor Boss. Supervisor Chappelle.
Thank you, Chair Kehoe. I attended the Shasta 5, which is the Shasta Children's Family and First Commission. On Wednesday, we had a 7-hour meeting, which they referred back to the things that have happened throughout that year, and then also the additional items that they want to present for this coming year for them. And basically, it involved with reviewing a draft strategic plan, and then we will review the scope work for each pathway goal, and then improve the budget for 2013, 2014. And then we also need some additional commissioners, so they were talking about the recruitment process with that. On Friday, I attended the Grand Oaks Elementary School, which was the DARE graduation, which was pretty cool. These kids are a very young age and learning about drugs and alcohol abuse and what it does to them. There were 33 graduates. A few of them didn't make it because the curriculum, they have a curriculum standard with that. And if they don't get through that, then they don't graduate, which the ones that didn't, they'll probably be on next year and make it. But there's work that they have to be involved in, and it's work that they take home and work with. And I think this is an excellent program in as much as that if I think it's the proper age to start being aware of drug and alcohol abuse. We've got it in our Shasta high schools, every one of them. And I commented on that, and I commented that, you know what, remember what you've learned back here. And every one of them had to write a report, and I said, pull that out and read it once in a while. So I think this is a great program. Sheriff Thomas Henkel was there also, so thank you.
Thank you, Supervisor Chappelle. We'll now move to item R7, appoint members to the Public Health Advisory Board and receive Public Health Advisory Board annual report. Good morning.
Good morning. Chairman Kehoe, members of the board, Terry Fields Hostler, Public Health, Branch Director for the Health and Human Services Agency. I'm very glad to be here this morning to ask the board to appoint members to our Public Health Advisory Board, also known as FAB, and to receive a very brief annual report from our current chair, Barb Jackson. The board helped to approve the creation of the FAB in November 2001. Of the 15-member FAB, 5 of those positions are appointed by supervisors from their respective districts. 10 are general membership positions. The FAB voted unanimously at its meeting on March 13th to recommend that the Board of Supervisors appoint Julie G. to fill 1 FAB general membership vacancy through March 31st, 2015, and to please reappoint 3 current FAB general members to new terms expiring on March 31st, 2016. Those members include John Coe, Teresa Flynn Gassman, and Jim Holdridge. And in accordance with the FAB bylaws, I'd like to turn it over to current Chair Barb Jackson for a brief annual report.
Thank you. Ms. Jackson, welcome.
Good morning. Thank you for having me here today.
Thank you.
I'm Barbara Jackson. I am representing the Public Health Advisory Board today, and I just want to spend a couple of minutes giving you all a very brief report on some of the different activities and opportunities that the Advisory Board has been involved with this past year. We've had the opportunity to advise the branch on a few different programs, one being the Community Transformation Grant, which included smoke-free multi-unit housing, the chronic disease self-management, Rethink Your Drink campaign, which included some youth engagement, and also the 2012-13 influenza season and the nurse-family partnership. Beyond those, we also get the opportunity to advise HHSA regarding some different health topics, and some of those this year have included the Public Health Safety Realignment and Prisoner Release Program and how it's impacted public health services. Also, the health impact of environmental tobacco smoke, the health effects of sugar-sweetened beverages, the gonorrhea outbreak in Shasta County, and mandating the flu vaccine or wearing of masks for the healthcare personnel, which will be in fall of 2013. As Public Health Advisory Board members, we also have the opportunity to participate in some different educational activities for us outside of our regular bi-monthly meetings that we have. And those this year included participating in DUI sentencing trial at Central Valley High School, the Shasta Community Health Homeless Picnic, which also included a tour of the Hope Fan, and the Shasta Healthy Smiles dental screening, which is, all of those are events that are opportunities for all of the advisory board members to attend. We also get a chance to celebrate some of the things that happen here in our county, and one of the big ones that we do was the 10th Annual Excellence in Public Health Awards. And this year we want to make sure that you're all invited and are aware for this year's event will be held on May 17th, and we would love to have you all in attendance. And some of the other things we got to celebrate is we did get our opportunity to say goodbye to HHSA Director Marta McKenzie and help celebrate her retirement with her. And we were very pleased to welcome Donnell Ewert as the new HHSA Director, and Terry Fields Hosler as Director, and Brandy Isola as Deputy Director for the Public Health Branch. And in addition, we also had some changes in our own advisory board. We welcomed Rachel Luke as a new advisory board member and said goodbye to Colleen Hopper and Julia De La Rosa Blair. I would like to just take a moment to acknowledge other advisory board members that are here with me today. I think Jim Holdridge is probably the only one still left. We had a couple of members here today that had to leave for other appointments, so I would like to acknowledge advisory board members. And would really just like to close this report by saying that we really are proud to serve on the Public Health Advisory Board. We really look forward to all continuing working together and along with staff and community to provide input, assistance, and support to the many different public health programs that are designed to improve the overall health and well-being of all Shasta County residents. And at this time, if you have any questions, Terry and I will both be here to
Questions
answer.
of Ms. Jackson or Mr. Holdridge or Ms. Losler?
I just one comment, Chair. I just wanted to thank Barb Jackson. If you noticed in the report, we did just reappoint her to a 3-year term, and I want to thank her for agreeing to do that again. I think we talked earlier about our other volunteers with the Red Cross, and this is another example of how many people in our county are willing to put up their time. You know, Jim is going to probably be reappointed here in a second as well, but there's just all the committee members who give of their time and to try to make our county better and stuff. And it's just, we're so really fortunate to have great people in Shasta County willing to take on these tasks.
Thank you. Thank you, Brett. Now, prior to entertaining a motion concerning disposition of this item, I'll call on Mr. Alexander to make some remarks. He is requested to do so. Good morning, Mr. Alexander.
Before I begin my remarks, I want to bring to your attention this board totally forgot to consider sub-item 3 of R6, which has to do with the Fall River Mills sign relocation.
Consider that.
The motion was on sub-item 2, not sub-items 2 and 3.
We did that first.
Oh, you did? Well, at any rate, thank you for the opportunity here today to address the board on the matter of the proposed PHAB appointment and reappointments. Here's a question. Would the balance of PHAB approve for appointment and reappointment anyone who is not fully supportive of health and all policies? Judging by the remarks given by the previous speakers, I think we know the answer to that question. And some of the highlights of that health and all policies include various, include the smoke-free housing, and other things. But let's also look at how health and all policies works out in other areas, such as New York City. Michael Bloomberg's ban on sodas. It was either last year or the year before, our own District 3 Supervisor, Glenn Hawes, voiced support for a soda ban here in Shasta County, perhaps one more comprehensive. And who could forget North Carolina's version of health and all policies, where under a schoolgirl's turkey sandwich was declared unhealthy because it did not appear on a pre-approved menu. And of course, increasing numbers of schools across the country seem to think it is healthy to totally expunge the word Easter from their vocabularies, saying that it is not Easter break but spring break, and that the Easter bunny is the spring bunny, and that the Easter holiday is an administrative day. Let's also not forget about the smoking ordinance proposals that have been bandied about in Reading and Anderson and elsewhere, not to mention the ban on biomass as home heating fuel. What we need on PHAB are people who will serve as a watchdog against this kind of health and all policies business, and not someone who will merely rubber stamp it. Thank you, and Feliz Pascua, which is Spanish for Happy Easter.
Well, thank you very much, Mr. Alexander. Pleasure of the board concerning disposition of item R7.
I'll move approval, and I just want to make one comment. I know Mr. Alexander has a lot of concerns about the health stance that he feels that the county has taken in some of our boards, but on just one particular issue, because he keeps bringing it up, is I'm very adamant that we should try to keep people from smoking. And you seem to have an issue with that, but I think that it's been very well shown, documented, that smoking is a detriment to people's health. It's very serious. It kills people. It's just, there's no debate about it. And so I just feel very strongly that we should try to keep people from smoking if we can.
Is there a second to the motion?
I would second the motion.
So we have a motion and a second. Further discussion on the motion? All those in favor, please say aye.
Aye.
Opposed? Motion carries unanimously. Thank you. Item R8 is adopt a salary resolution adding 37 positions in the social services budget. And Mr. Darker has requested to speak on this, so let's have the staff report first, and then we'll invite you up, Mr. Darker. Good morning.
Good morning. Melissa Jenilevich, Regional Services Director with the Health and Human Services Agency. Good morning, Mr. Kehoe and board members. So the item before you is indeed a salary resolution, and it's requesting these positions to prepare the Regional Services Branch for additional responsibilities related to the Patient Protection and Affordable Care Act. Donnell Ewert, our Health and Human Services Agency Director, was here on February 28th and gave you an overview of the Affordable Care Act, or ACA, so I won't be repeating any of that information. You have a good background on that. The Affordable Care Act does go into effect on January 1st of 2014 for all Americans, and for our purposes, we need to be able to be delivering services by October 1st of 2013. So that's coming right up. It's approaching very, very quickly. Counties will be expected to begin providing services to those seeking health insurance enrollment by that date. So the three areas of responsibility that we will have will include responsibilities with a Medi-Cal expansion. We will be assisting with Covered California applications, and we have a proposed customer service center expansion. So the first staffing need is related to the Medi-Cal expansion. And with implementation of the Affordable Care Act, Medi-Cal is expanding its eligibility to include single, childless adults between the ages of 19 and 64. Those individuals have previously been served by our county indigent program called Path to Health. We have approximately 3,800 of those individuals currently in that program. Those individuals will need to be transitioned into Medi-Cal, creating a substantial workload in that transition process. In addition, we anticipate more Medi-Cal applications related to outreach and information that will be in the public because of the healthcare coverage requirements and the health plans information being out there. What are the health plans? How do I apply? That information will be out there, and the requirement that you must have coverage by January 1st. People who previously have been eligible for Medi-Cal but didn't apply will most likely apply. So our estimates based on the number of low-income individuals in Shasta County that are currently uninsured, plus our current application trends, lead us to believe we could have 1,674 additional individuals that will be applying for Medi-Cal, additional workload. So the Covered California Applications Assistance is another workload that we'll be required to assist with. Covered California is the statewide marketplace where individuals and small businesses will purchase a range of health insurance plans through a variety of options, including online, over the phone, and in person. County eligibility offices will provide the in-person option for those enrolling in Covered California that need personal assistance. In Shasta County, we estimate there's about 10,100 individuals that are eligible for federal subsidies, and our estimates are up to 1,000 of those individuals will visit our Health and Human Services offices for assistance in the first year of the program. Even though those individuals won't be eligible for Medi-Cal, we're expected to serve them in a no wrong door sort of approach and help them with their applications. So the staff being requested for those two staff additions, those two responsibilities, are 10 eligibility worker 1-2 positions to take the applications and process the ongoing casework with Medi-Cal. 1 eligibility worker 3, a lead worker that will do case authorizations and quality assurance, an eligibility supervisor to oversee the additional staff, and an office assistant to provide support for a total of 13 full-time equivalents. So that's separate from the call center. Those are our equivalents that we need to do for our Shasta County residents for that extra work. I'm going to take a drink of water. So the third staff need is related to the proposed customer service center expansion. All California counties' eligibility offices will be required to have some sort of a connection with a call center because the Covered California screening process will identify individuals that will be eligible for Medi-Cal. They're going to call, they want to sign up for the health plan, they'll be screened and appear to be eligible for Medi-Cal. A warm handoff needs to occur from a statewide call center to a local call center, a local eligibility office, to complete a Medi-Cal application with those individuals. So that's what our regional call center would be doing, would be completing those Medi-Cal applications, Medi-Cal intake applications only. So the regional call centers are being organized through existing consortiums that have done our automated case management systems in the past. We belong to a consortium of 39 other California counties that have cooperated with those systems in the past, and we've been selected to provide call center service for 8 other counties and ourselves, so 9 total counties for this call center service. So it would be Shasta, Del Norte, Lassen, Modoc, Plumas, Sierra, Siskiyou, Tehama, and Trinity counties would be the counties we would be providing the call center service for. We would be one of 6 regional call centers that are serving those 39 counties. All 39 of those counties would be connected to a regional call center. So it would be a system of call centers for all of those counties. The other regional call centers would be Riverside, Monterey, Stanislaus, Merced, and Humboldt. So it's not just us that's the regional call center. It's a system. So Shasta County's call center is anticipated to receive 471 calls a month, each of those calls lasting approximately 60 minutes. We have pretty stringent expectations for performance with those. 80% of those calls would be expected to be answered within 30 seconds. And the hours of operation for the call center would be 8 a.m. to 8 p.m. Monday through Saturday during the open enrollment time for the Covered California Plan, so October 1st through March 31st of 2014. The hours of operation would change after open enrollment period for the plan is closed. So for that workload, that specific request, we would need 17 eligibility worker 1-2s to answer those calls and complete those applications, 2 eligibility worker 3s, lead workers, to again authorize the cases and complete quality assurance, 2 eligibility workers to do the scheduling and assign the work, an office assistant to provide the clerical support. So this specific request is for the call center expansion is for 22 full-time equivalents. In addition to that work, we are also requesting a staff services analyst to help with the training. This is a major shift in how we do business. It's a whole new way to calculate Medi-Cal eligibility that we have not performed in the past. And every single eligibility staff person needs to be trained in the new work. So we're asking for an analyst to oversee the training. We're also asking for a program manager to oversee this change management process and supervise the additional staff. We have received a funding allocation totaling $88,426 to offset the costs for the program manager position through June of 2014. So we're asking for that position to be a sunset position through June of 2014, at which time we would come back with a recommendation to you about the necessity for that position to continue. So with the exception of the program manager position, the remaining positions would have a requested sunset date of June 30th of 2015. At that time, a recommendation to retain or modify or eliminate the positions would be proposed to the board. If workload reductions were to occur earlier, modifications could be made in staffing by holding vacancies open in anticipation for reducing the number of allocations. HHSA is requesting these positions be established at the earliest possible time to ensure as much flexibility as possible for recruitment and training of the new staff. Eligibility workers typically undergo 8 weeks of training prior to 4 to 6 months worth of on-the-job training before they really function independently, and we're now 6 months from October 1st. So the financing for the positions will be primarily through the Medi-Cal allocation, and costs will also partially be shared with our CalFresh allocation because individuals will be eligible for other programs as well as the primary program they're applying for. 50% of the costs for the Medi-Cal funding come from the federal level, and there's no question about those being received. We know those are available for us. The state dollars are still in discussion. The California Welfare Directors Association is working with the California Department of Healthcare Services for those clarifications. A proposal was submitted about 3 weeks ago. That's under consideration. No red flags have been sent back from the Department of Healthcare Services saying this is a concern. So at this point, things are looking pretty positive for that funding to come through. Sufficient funding does exist in our current social services allocation and in our approved budget to sustain these positions until the funding is more clearly defined. So with that, I will take your questions.
Questions of staff, please. Ms. Giacomini, Supervisor Giacomini.
Thank you, Chairman Kehoe. Thank you for the report and the explanation. I guess the biggest question in my mind, so say the state budget doesn't come through with the other 50%, what do we do then?
So our the call center piece, I'm going to talk about them in pieces. The call center piece is sort of a package deal. The descriptions, the understandings about that are the technology is secure. The funding for the technology expansion of the call center, that's already worked out. That piece is already worked out. But the staffing piece, it's clearly understood that counties are not taking on regional call center responsibilities unless it comes at no cost to the counties. So if the state does not come forth with the money to support those positions, it's clear that we won't be taking on the responsibility of the regional call center.
Okay, so just to follow up then, we're going to go ahead and advertise for these positions, and then we may not hire them?
So this is the method that they are choosing to address the in-phone, over-the-phone application process, and there's no other process that's being pursued other than this. So there's no other discussion on the table about how they would address meeting the requirement of the Affordable Care Act for the phone call requirement. So they can't promise that the funding's coming, but there's nothing else being considered at this point. I don't know how else to say that. So.
Other questions, please? I have several questions, and I'd kind of like to split them out, and then I'd like Mr. Darker's presentation. So the 13 positions that you're asking for is in response to our responsibility under ACA. We don't have an option there, is that correct?
That's correct.
Okay, then let's move then to the 22 positions plus 3 for a total of 25 for the call center. Perhaps you and Mr. Lees can talk about the upside in doing this in Shasta County, and then also any potential downsides. And then where are you planning to relocate or to locate this regional call center?
Do you want me to go? So I'll take the last part first. That's the most concrete.
Sure, yeah.
The regional call center expansion would be accomplished in our existing building at 2640 Breslauer Way, and that's where our existing call center is. We would take our existing interview space where we do client intakes and convert that to the space for the additional call center agents. The infrastructure is already in place there for the call center. It would be pretty straightforward to expand the services there.
Okay. Mr. Lees.
I'd just like to make a quick comment on the benefits. Clearly, well, actually, let me talk about the potential issues. Obviously, the biggest potential issue here is that for some reason funding doesn't come through. I don't believe that will be likely because it's going to be law, and California will have at risk a lot of federal dollars. Most of these dollars will be actually federal in one way or and another, and it's their program that they want to have happen. So I believe that that risk is minimized. However, I'd be naive to think that there's not going to be significant adjustments and changes to this program over the next 2, 3, 4, 5 years as it rolls out, because it just came too fast, and I don't think I don't think there's anyone who has sat through all the different scenarios that could take place. With that being said, though, let me talk about just the benefit, and I've shared this with this Board of Supervisors before, but it's kind of been my thing to showcase Shasta County as the spot to do business, and meaning I wanted to send a message to the state and to the feds that if there's going to be any regionalization and the creation of jobs, we want it to be here in Shasta County. Makes sense. We're the hub of the North State. This is where it needs to be. We started with the regional call center for Ms. Terry Love, our Child Support Services Director, that she promoted and now is in place for 5 to 7 county area call center for child support services. We now are as you've heard me say before, we have now combined the 4 county region of the Housing Authority, where Shasta County is now the housing authority for this 4 county region. And this would be yet another step where now they're asking if we would do this, and that's just the signal where I'm trying to send. That's just what we want. We want the state and feds to say, the need for this consolidation is here. We think we could do it efficiently and better. Let's consolidate. And I want them to always come to Shasta County first and then let us decide if it's something we can do. And this is something I would certainly support. And I love sending that message that Shasta County is the hub of the North State.
Mr. Lees, I am troubled by the ambiguity associated with the vagueness of funding. As I read the section on financing, we've stated twice that it is anticipated that the funding will be coming forth. We say here, staffing for the regional customer service call center is anticipated to be paid entirely through the allocation of federal and state funds passed directly to Shasta County on behalf of the covered counties. And I admire your confidence in state government, and I know that money will be forthcoming. But what troubles me, and maybe you're right, I don't know, but what troubles me is the observation you made earlier that of the 38 positions, you intend to start hiring immediately. So if we start hiring people and then that money is not forthcoming,
let me address that if I might.
Yeah, go ahead.
Clearly there is a risk there, but how we mitigate that, how I support this process and mitigate that risk is we also have there is an initial investment on our part. That is the risk. If after we start hiring these people and then in 5 months we find that the state and feds we're going to change our mind and fund it somewhere else or do something different, then we've hired these people and we have invested in that training and hiring for those first 3 or 4 months. I think we'll know actually by then whether the money's going to flow or not, but that is a risk, and I think your observation is correct, Chairman Kehoe. How we mitigate that risk is this. We have a typical well, not typical, but we have a normal attrition pattern within Health and Human Service Agency to where we have so many people leaving the business for retirement, moving, things like that. So we have almost a constant opportunity to place people in different positions within the HHSA environment. And so that's how we would mitigate that risk. And I would say that for the most part, if all the money was to not be there and we had invested this initial 3 months or 4 months of training before we found that out, that our money would be well invested in that we would now take those people and move them to the parts where we've had people attrit from the different parts of the business, eligibility workers and things like that. We have a normal flow of in and out of eligibility workers and things like that. Will it cover all of the positions? I'm not sure, but that's how I would recommend we mitigate, and that's why I'm recommending this go forward.
Mr. Lees, then, it is not an accomplished fact that the regional call center has been approved by the state and will be located in Reading?
No, it's not. It depends on the outcome of this discussion today. We need to, give our consent, whether we want to participate in this or not.
We have to show the state that we are interested and willing to accept their proposal.
Okay. Any other questions from board members? Yes, there you go.
Thank you, Chair Kehoe. Bring the jobs to Shasta County. On the various boards that we all sit on, I think that there is the realization that Shasta County is looked to as the leader in the North State, and there's no doubt about that. It seems like on a weekly basis, when you attend these various meetings, they're looking for Shasta County and how we've created decisions within the Forest Service or within healthcare or whatever it is. Shasta County has become a model for many of the smaller counties. So it makes sense to me too, and I can see why other counties would feel comfortable having county take the lead on that. Let me ask the question a little bit different way. If we don't take this risk, we know this program is here. It's not as if we have a choice, and so we're dealing with the reality that we're going to provide services for for a program where everything is not answered today. If we don't take this risk, if we don't train, then we're going to have a date that will very soon be upon us without trained employees, without the ability to take care of them. And then what would we do?
Yeah. Well, and then obviously what the state in this case would do is they would look for, we would still have a responsibility, and so some of those jobs and responsibilities would fall to us. As it relates to the consolidated call center, the state would look for another county that would be willing to pick up those responsibilities and make that initial investment. And I will add further mitigation just to, we've put sunset dates on these positions just for that reason. And although it's a couple years out, I recognize that we have off-ramps before that if funding doesn't come through, to where we're not going to retain positions if the funding and the work is not there.
Anything else? Mr. Darker, please.
Good morning, Chris Darker, Business Manager, United Public Employees of California, Local 792. Honorable Chair, Board of Supervisors, good morning. I just wanted to rise this morning in support of R8 and ask that the board approve this proposal. I'd like to thank both Melissa and Michelle for preparing this today and bringing it to your attention. I think it's a good thing for Shasta County, and I think it's good that they got on top of this right away. Regardless of our political views on the Affordable Health Care Act and the future of that, I think we do need to prepare for this additional workload that's quickly coming upon us here. As you are aware, our members who work in social services are hardworking folks, and they really care about this community. I have the opportunity frequently to talk to them and listen to their concerns and the workloads that they have and the stress that the time constraints have on them. So increasing the workload at the current staffing levels is really not an option for Shasta County. There's only so many hours you can work these folks, and I think the county and the union have worked together to keep costs down, to keep the number of people employed, so we do keep those costs down. But I think we've definitely reached the maximum already if we haven't gone over it. So additional, the ACA, with that, we know there's some things coming with it. I think there's probably a lot of things that we don't know, which will really, cause us to have other problems that we don't know of right now. So additional jobs in Shasta County are essential to this community. It's good for the economy, and I think the way this is written prepares us for the future that's probably inevitable. So it's good to be prepared for that. So I would like to say, though, that I would have liked to have been involved with the process of putting this and maybe have some input on the resolution. And maybe going forward, I'd like to have some input on that as well on behalf of the employees that do the job. So on behalf of the members of the United Public Employees and the social service workers, I highly recommend that the Board of Supervisors unanimously approve this proposal. And also I want to make a comment that I support Mr. Lee's comments on the mitigation of it. The eligibility workers do have quite a bit of turnover, and it's a tough job. So with that, thank you very much.
Thank you, Mr. Darkert. Further comments? Pleasure of the board concerning disposition of R8.
I'll move approval.
Thank you.
Second.
We have a motion and a second. Further discussion of the motion? All those in favor, please say aye.
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 Opposed? Motion carries unanimously. Thank you, gentlemen. Item R9, county purchase to allow for customer service center expansion.
You're not done with me yet. So this item is the companion item to the document you just approved, or the item you just approved. This requests the board to approve a county purchase document between Shasta County and the California SAWS Consortium 4, C4, to allow the expansion of the technology for the Customer Service Center. Signing this document confirms our intent to participate in this project and outlines an agreement for our terms to participate in the technology expansion. Shasta County has been selected to serve or requested to serve as the regional host call center for the 9 northern counties that we've already discussed to receive Medi-Cal referrals from Covered California's statewide call centers. In order to receive these, additional technology is required. So this purchase document globally covers services to configure and deploy local hardware and software required for additional customer service center agents, the actual hardware and software required for these agents' workstations, and then the ongoing operations for the central support for the administration through the wide area network. The costs are in the document. I don't know that I need to repeat those. I do have a couple of corrections for the document that I need to make you aware of. On page 4 of the agreement, item number 8, that needs to be stricken before we sign the document. This item talks about handling relationships between host county and subscriber counties, and that Shasta County would have been responsible for interagency agreements between the subscriber counties. That now will be a Department of Healthcare Services responsibility to outline those relationships, so that can be stricken from this agreement. And there's also a correction for the number of agents. So number 33 then on page 6 of 10. The number of agents listed there is 19, and it should reflect 17. So that would be page 6 at the bottom. It's in parentheses on the very last line, and it should be 17 rather than 19. So with those two changes, the document then should accurately reflects our agreement, and I would take any questions that you would have.
Questions of staff, please. I have some questions. Page 3 of 10, where we talk about approach. The host county will be responsible for several milestones, and then it explains what the milestones are. Are we in a position to embrace those milestones, assuming we go along with this contract?
These dates will have to be modified in accordance with approval from state and federal levels. We would be ready for installation of switches at any time, since we're using our existing building and we're using our infrastructure for our current facility. Circuit installation could happen really any time. And if you refer to, I think it's item number 34 in the agreement, the dates of this are going to be dependent upon state and federal approval. So they will be altered according to state and federal approval.
So the contract that we sign with these folks is going to be written in such a way to provide flexibility on some of these milestones, right?
Yes.
Okay. Let's go to Clause 14, where they talk about the uninterrupted power source. How do you plan to make that a reality?
With our current customer service center, we have a 4-hour backup power source that's available that would be used for this purpose. And right now, if we were to have a power outage that was longer than 4 hours, we have procedures in place where we would call a Southern California call center that would take our calls. In this new regional customer service center approach, we will actually have sign-ons for all 39 counties in our consortium. We would be able to back any county up at any time if they had a power outage, and they would do the same for us.
Okay. You've indicated that Clause 8 has been deleted.
Yes.
So by extension, does that delete Clause 36, where we talk about the costs for this county purchase and solution will be invoiced to the host county?
The invoicing process will be completed that way. We will receive an allocation for these costs, and we will be invoiced for them.
Okay. Do we have in place an agreement with the 8 counties, the 8 other counties?
We will not need to have an agreement with the 8 counties. We will have an agreement with Department of Health Care Services that will outline our responsibilities and our relationships with subscriber counties. And we will have relationships with other counties in our 39 county area as well for the purposes of backup in case of emergencies as well.
So if we buy this equipment and we're paying for it initially, we are not reimbursed by the 8 other counties?
It will be an arrangement with the Department of Health Care Services directly. We'll receive the allocation directly. The host count or the subscriber counties won't receive any money. We will receive it directly.
So let me ask this question of you, Mr. Lees. Are we yet again fronting money for the state of California on this deal?
We will be invoicing the state for our investment into the technology, yes.
So the answer is yes to the question. Okay. I guess that's it for my standpoint. Any other questions? Pleasure of the board concerning disposition of R9.
I'll move approval.
I'll second.
Well, that wasn't that painful, gentlemen. We have a motion and a second to approve item R9. Further discussion? All those in favor of the motion, please say aye.
Aye.
Aye. Opposed? Motion carries unanimously. Thank you for the presentation.
I was just going to make a comment about the purpose.
Item R10, solid waste disposal sites, BLM land transactions. Mr. Minturn, good morning, sir.
Good morning, Chairman Keough, members of the board, Pat Minturn, Public Works Director. Before you today is an item related to 3 pieces of property which have been used for or are related to county solid waste activities. And we've been in the process of acquiring these properties formally since 1989, but in some ways our history goes back a lot farther, as I'd like to explain. Perhaps I should start in old Shasta back in the mid-1800s. If I may. This is the old Shasta community, formerly the seat of county government. This is the road down Middle Creek that was constructed down to the railhead in the late 1880s or thereabouts. Along this road, folks started getting rid of their garbage from old Shasta. And in the good old days, that entailed dumping it in the creek or wherever, and literally, because it was convenient, gravity, and then it would be burned periodically. Each community in Shasta County had similar dumping grounds. And gradually, they were consolidated into a single site for each community, and often on BLM lands. On this particular site, as with many sites, the county started to be involved in probably around the 1930s, 1940s. The county started being the folks that formally burned the site and would bury the waste after the ash after it burned as well. And in the 1950s, the county actually acquired leases for this site. And gradually, in 1973, burn dumps were outlawed statewide, so the county consolidated all of these, turned many of them into transfer stations or shut them down. And the way a transfer station would work, folks come to the site, but instead of dumping on the ground and having it burned, the waste was loaded into bins initially, and then a truck would come and haul it off to the landfill. The landfills at that time, sanitary landfills, were at Enterprise and Buckeye. Those quickly filled up because burning reduces the volume, obviously. And when you were burning at remote sites, it was dispersed at those sites. When it started getting hauled to Enterprise and Buckeye and not burning it, quickly it became a big pile there. And so the county sited the West Central landfill and acquired a 1,000 acre ranch out there around 1980. It was an environmental document at that time. It was to be a long-term solution, and in 1990 the city came in, shut down their Benton landfill, and came in and also hauled to our landfill. And it's been a very successful landfill ever since. A couple things about the West Central site. This is the working area, as you can see, and here is the Veterans Cemetery. The landfill came right up against this section line, and actually this kind of a light strip here, that was actually a diversion cut. This is one drainage, this is another drainage, and a diversion cut was to divert the water out of this drainage over into this drainage so it doesn't go onto the landfill site. This was developed, and the landfill is now working in this direction. And next summer we anticipate, not this summer, but next summer we anticipate putting a cap over a portion of this. So this will be a green surface and no longer be worked. So gradually we're working away from the Veterans Cemetery. When the Veterans Cemetery was proposed, well, back in 1989, the county started efforts to acquire these 2 quarter sections of land, the one where the Veterans Cemetery eventually became, and this one as well. There were some problems with that back in 1989. There were mining claims on all of this, and if the county had acquired them with those mining claims could have gone on, could have been a nuisance to us. And so basically we waited them out. We talked to the mining claim folks, and they want $145,000, and the mining claims weren't really valid. They weren't financially viable. I won't say they weren't valid, but they weren't financially viable to work, as evidenced by the fact that they never were worked. But we had to wait them out. And they expired when the cemetery was proposed. The BLM transferred this property first to the county. The county purchased it and then turned around and sold it to the state for the development of the Veterans Cemetery with a 400-foot wide buffer here. They don't come onto our buffer, we don't go onto theirs. It makes a good separation. This piece here remained out there, and we continued to negotiate with BLM over the price, the terms, and now we have come to terms. And purchase price is in the staff report. It's approximately $140,000, as I recall, $184,000, excuse me, based upon a current appraisal conducted within the last couple months. Another parcel that's involved in this as well, so that's before you today, to purchase that from BLM for $184,000. Also, to acquire this piece, which is now a transfer station site, the one that I discussed, the old Shasta transfer station, for continued transfer station operations. I will say that we did an environmental assessment of this. Lawrence and Associates was hired, and they studied it. They looked into it. There are some areas that the county was never involved with out there, right along Middle Creek Road, which the trail now goes through, and there were some solid waste there. We had some concerns about that, so we worked with BLM and had that excluded from the take area. So the only area that's involved now is those areas up here higher up on the hill where the county was involved in burning the waste, was involved in burying the waste over the years. It's a fairly stable site. Lawrence and Associates did not identify any known environmental concerns. These old burn dumps are actually pretty innocuous in that the fire consumes the volatile organic compounds, the nitrates and so forth. What's left behind is some metals, and the pH is raised so those metals can't migrate. They're very stable. The old timers, they knew what they were doing perhaps, or at least time has proved that out. Another site that's involved is the French Gulch site. French Gulch, when the community was formed back again in the 1800s, they seem to have originally hauled their waste down to the Whiskeytown site, which is now underneath the lake. So the county, in conjunction with the construction of Whiskeytown Lake, cited another site, and it was up here on Klein Gulch Road, up towards Klein Gulch. And it's 1.96 acres. The plan was to bury waste on that site. It was not a burn dump. It was a sanitary landfill. It only operated for a few years in that capacity, though, taking the waste just from the local area. And it was converted to a transfer station, and it continues to operate as a transfer station to this day. The local residents go there 2 or 3 days of the week. It's open. And again, Lawrence and Associates did a study of this. Some of the waste was found to be outside of our lease area that we had from the Forest Service, or from BLM, excuse me. And so the legal description was changed to encompass that area, and it is all buttoned up now, potentially for sale to us. So the package deal as proposed is for us to purchase the West Central site for its appraised market value of $184,000, and there's never been any development on this site. We are purchasing the surface rights. BLM continues to own the mineral rights. Nobody can file a mining claim, though, is my understanding. And since there's a veteran cemetery next door, I think it's unlikely that the federal government or county would ever put this to any use. And the county cannot expand its landfill onto this property because BLM owns the mineral rights. The reason why we desire to acquire it is, first of all, to keep a subdivision from going in there. Subdivision obviously would be the worst thing. This is an isolated BLM holding. They've been alienating their isolated holdings and consolidating along creeks. It's a chance for us to secure this site. Also, we want to put some gas migration monitoring wells on this site to make sure that we're not having any problems moving off site. So our plan is to maintain this in perpetuity in its native condition. And it would also be available if the veteran cemetery in 100 years ever moved that far north. Certainly the board would be in a position then to provide those lands. But our plan is to maintain it as a buffer in perpetuity. The old Shasta site, the proposal is to transfer this to the county of Shasta for a transfer fee of $50. That process has already gone through the Federal Register process, as the landfill property has. And the patent is in their Sacramento office, and within a month approximately, we can take title to this and continue to use it as a transfer station. The Klein Gulch site and French Gulch is behind a little bit in that process. It's probably a good 3 months out. It's currently in the Federal Register. And so this comes before the board today, these three as a package deal. And the reason why these are coming forward as a package deal is that the BLM obviously wants to complete all these transactions. They would want to be out of the county's transfer station business, be rid of these lands. But also, back in 1998, there was an agreement to that effect, informal agreement between Bill Lyman, then the county public works director, and Chuck Schultz, then the BLM area manager, that we would work towards a common resolution of these three. And that's why it's before the board in the form that it is today. Today in the audience is Jennifer Maida, the new Reading field manager, and her staff, if you have any questions for them, and I'd be glad to answer any questions at this time.
Thank you, Mr. Minturn. Any questions, Mr. Minturn? Mr. Minturn, when you describe this as a package deal, can I also describe it as an all or none deal?
My understanding from BLM is that is their sentiments.
Okay. As I look at your staff report, then it says the three parcels collectively offer substantial benefits and pose manageable risks. What does that mean, manageable risk? I assume that is germane to the old Shasta site and the French Gulch site.
Yes, there are no boundary disputes, there are no particular safety issues with these sites. It's a matter of an old waste site, and we know that waste was buried there. Any site bears some liability. The county is in the solid waste business, certainly the landfill. We will have liability for that forever. We're in that line of work. These sites, in my opinion, based upon my experience in working with the county's old burn dump sites, as I explained, the monitoring that's been taken and carried on in these sites, the investigations, my understanding of these sites as an engineer, I believe that the risk of migration of waste off-site is low. I believe that the probability of regulatory action is low to moderate. I believe that if we were ever on the receiving end of some sort of a cleanup order, it would probably involve the construction of a cap, improved grading of the site to improve drainage, perhaps removal of some surface wastes that are visible on some of the sites. There's metal pieces. So I believe that the costs might be on the order of several $100,000 potentially. That's somewhat of a worst-case scenario, I believe, with these. And our solid waste program is self-funding. We are internally, it's an internal service fund. We are able to operate the landfill without a government subsidy. We are able to operate these transfer stations without a subsidy, and that includes risks associated with the handling of waste. And so I believe that these sites can be managed in line with our business operations.
Good. Thank you, Mr. Minturn. Supervisor Modi, followed by Supervisor Chappelle.
Yes, thank you. I just want to express my appreciation for staff's work on this as well as BLM. I support this resolution to this issue. This is something that's been ongoing for, as Pat mentioned, probably 20 years. He and I have had discussions about this since I came on the board almost, over 4 years ago. It's something that's been a concern of his because of, the property north of the landfill, or this west central landfill, the concern that if that were to be developed, something would cause huge problems for the county perhaps in the future. And then along with that, I know that they're concerned about manageable risk, but on the flip side of this, it actually encapsulates our exposure. We've defined what the boundaries are, what we own, what we don't own. We know what that is, and now we'll have to worry about, this transfer station, Old Shasta, this stuff spilled and went down the creek and went here and went there, and then we're on the hook for all this stuff. And so in the end, it helps the residents out there realize that they've got a place to do a transfer of their trash, which is what we need them to do. It secures those sites and at the same time protects our exposure, I think, from that in the future, as well as making sure that we don't have future problems at the West Central landfill. We've had, even last year, concerns about drainage from that upper area coming down, putting too much water into the landfill area. That caused some exposure for us there. So this, I think, helps solve a lot of those problems. And so I want to just thank both Jennifer Mata for her effort as well as Pat Mint for his to help bring this into a resolution. And I know we have some more discussion, and when you get finished, I'll make a motion.
Very good. Supervisor Chappelle.
Thank you, Chair Kehoe. I think Supervisor Modi probably expressed some of my concerns. I was just wondering the 160 acres. He said it was a buffer. Is that so it won't be developed or anything like that? And then I think Supervisor Modi just talked about the drainage and so forth with that, the benefits that would be.
Yes, to go back to the West Central site, this is really the centerpiece of this transaction. And we've been working on this since 1989, working through the mining issues. These shaded areas are BLM's holdings in the area, and you see it's an isolated holding. And BLM has been selling off all these patchwork properties to consolidate along, Clear Creek in particular, and down along the Sacramento River. They're consolidating their holdings for recreational purposes, and so it would be natural for them to sell off the site. If they sell it off, we wind up with 160 divided by 5 would be 32 ranchettes next door to us. And we don't want that in the property. I don't think they would be happy next to us ultimately. Better that this be maintained in its natural condition, added to our 1,000 acres that we already possess. And there are advantages to being able to monitor on site and making sure that we are our own neighbor and good neighbors with the Veterans Cemetery.
Thank you.
Further questions? Mr. Modi, is there a motion, please?
Yes, I'd make a motion to approve this agreement with the
Thank
BLM.
you.
I'll second.
Have a motion and a second. Further discussion on the motion. All those in favor of the motion, please say aye.
Aye.
Opposed? Motion carries unanimously. Thank you, Mr. Minturn.
Thank
And
you,
thank
Mr.
you,
Chairman.
ladies and gentlemen. We appreciate you being here. Shasta County Board of Supervisors will recess and convene as the Shasta County Housing Authority. Do you ladies need a minute, or can we proceed? Okay. The Shasta County Board of Supervisors does not receive any additional compensation or stipend for acting as the Shasta County Housing Authority. Dr. Coons, good morning.
Well, we're close enough. I'm going to say good afternoon. Chairman Kehoe, members of the board. Richard Coons, Director of Housing Community Action Programs. Here to ask the board to consider approving two resolutions which pertain to the operation of the Housing Authority. The first one is our compliance plan, which is a HUD-driven document that is essentially outlines how we spend our federal allocation. And this one, we're supposed to have a public hearing to receive comments from the public on that one. What you'll see with this plan is most of the plan is marked non-applicable, and it's a very short plan for a couple reasons. One, we do not own public housing. The other one is we spend all our funding on Section 8 vouchers. And the last one, we are a high-performing housing authority, which means we have no findings, so they allow us to fill out the short form. I'd be happy to answer any questions on this one before the public hearing.
Any questions of Dr. Coons? This is a public hearing. At this time, I will open the public hearing in the matter of the Housing Authority Annual Plan and Administrative Plan. Is there anyone present this morning that would like to address the Board of Supervisors in this matter? Seeing and hearing no one, I'll close the public hearing. The pleasure of the board concerning disposition of this matter.
Move staff's recommendations.
Thank you.
Second.
Have a motion and a second. Further discussion on the motion. All those in favor of the motion, please say aye.
Aye.
Opposed? Motion carries unanimously. Thank you.
Does that cover, because we have two resolutions, that cover both resolutions?
Yes.
Okay, thank you very much.
You know how
With
to,
your intent.
That was my intention, yes.
Yep.
yeah. See, you're very succinct in your report. You got, see?
I still made it before or after.
Shasta County Housing Authority will adjourn and reconvene as the Shasta County Board of Supervisors with the following closed session announcement. We are to discuss the following items, estimated at 45 minutes. Conference with legal counsel, Carroll versus County of Shasta, Solis versus County of Shasta, Moen et al. Versus Dell. It's a class action. Anselmo matter and a second Anselmo matter. At the conclusion of the closed session, reportable action, if any, will be reported in open session. We will now recess to our closed session. Thank you, ladies and gentlemen.